Ludford, Chief Executive of the Murrumbidgee Local Health District. I'm here today to give you an update on how we're travelling with COVID across the Murrumbidgee region. So for us, our numbers are remaining at 49 people who have been tested COVID positive over the time that the pandemic commenced in March. As we have previously discussed, we had additional cases over the last couple of weeks, 3 cases in Albury and 1 returned traveller from the Snowy Valleys Shire. In great news around numbers, so we've now clocked up nearly 30,000 tests. People coming forward from our community to be tested since we started testing again in March. We've really seen the numbers ramp up enormously in the last week. We've done 500 additional tests just in the last week. And we're now testing about 2,000 people across the Murrumbidgee region every week. So again, really important messaging, given the heightened concern that everybody's feeling at the moment. Not only are we seeing increasing high numbers, triple digit numbers in Victoria, 374 people, again, new cases there yesterday, but only 13 new cases in New South Wales yesterday. But people are concerned now because we've started to see what happens when we get a cluster of COVID start to seed. And a great example of that is what we've seen in Sydney over the last 2 weeks, where a traveller from Victoria went to the Crossroads Hotel, and then we have seen seeding in those suburbs of Liverpool and Campbelltown area where we've seen smaller outbreaks. Fortunately, with the systems that we've got in place around testing, early detection, and then putting people into isolation early has meant we've been able to ring fence those new seeded outbreaks. And we saw a recent one, again, of one of those cases who travelled down to Bateman's Bay, not understanding they were symptomatic, and we had a small outbreak in a regional part of New South Wales. So I understand you are all concerned that the COVID outbreaks have come across into our region, but I just want to reassure you that we have increased our staff to undertake more tests. That's how we can keep ourselves safe. If we can identify COVID cases early and then put those people into isolation, do the contact tracing, then we can ring fence any possible outbreaks that occur. So we've also seen a really great improvement in the turnaround times of our testing samples, now down to about 24 hours on average for those going through New South Wales pathology laboratories. Also, for people coming to our hospital who've got respiratory symptoms, we can turn around a rapid test. If that person's very unwell, we can know within an hour or so if that person is COVID positive or negative. That's important for our healthcare staff because we have to wear PPE until we know somebody's COVID status. So we are maintaining those separate pathways for people in our ED, in our wards, in our services for people who have respiratory symptoms. We are also continuing screening across not only transport hubs, airports and train stations, but when you come in to visit one of our hospitals, and all staff visiting our hospitals are screened each and every time they come in through the door. Temperature test, a range of questions. And for people who have been in hotspot zones, the identified zones that you can see in New South Wales on the website, or in Victoria, those people will not be able to enter our facility. And we ask them to go home and self-isolate and watch for symptoms. If they're symptomatic, it's very important they're tested. So heightened anxiety, but we're here to protect you in collaboration with New South Wales Police, who do a great job in assisting us. Finally, I just want to talk about sporting venues, and we've seen the easing of restrictions, and then we're seeing restrictions now tighten up again. And police will talk about that with you later in this press conference. But I want to talk about sporting venues because we've seen children able to return to sport, and it's important for our children to remain active. It's part of them being healthy and happy. So those COVID safety plans that our sporting bodies are asked to produce, so far we've seen some really good work by communities. But there's a couple of messages for you as parents if you are attending those activities with your children. The first thing we say is, can you please limit the number of people watching your children play just to carers and parents? please, so that we don't have the mass and the high numbers of people on our sporting grounds. It's also important for the organisers just to spread the matches out a little bit so that we don't have, again, the large numbers of people. And once your child game is complete, we would ask you to leave the oval and return home so that we don't have people mingling. So it's a strong message there. For coaches, we're asking you to ensure that you don't have the oranges and the fruit, and there's none of the handshakes or hugs when children do really well. So we can continue these activities if we take into account how we can remain safe, how we can keep our social distancing on the sporting oval, and how we can continue to allow those activities that are so important for our children's health. So finally, the border restrictions that we've seen come into place. There's been a new order that's gone up on Service New South Wales website overnight, and as of midnight last night, everybody who previously held a permit to come into New South Wales has had to reapply. This is causing some confusion, but the order is really clear and it has been tightened significantly. So the first change we've seen is the border zone across the Murray River, clearly defined, and there is a map on the website, and you can see the blue zone that travels along the Murray River that clearly outlines whether you are living or not living in a border community. People will only be given a permit to come into New South Wales under exceptional circumstances. It is to access time-critical healthcare that is not available in Victoria, for health and education reasons, again, where they can't study at home, and for work-related activities, again, where people can't work from home. So those are the only times that people will be given a permit. There are other groups that are specified in the order around people who are truck drivers, freight carriers, people who are in industry. Those are clearly outlined in the order, and those people will need a permit, and they will also need an industry COVID safety plan. And those safety plans will set out the particular conditions that particular industry will need to adhere to. So we ask for your patience. I understand there's quite a long queue of cars along the border at the moment as police are having to recheck for people's permits. The website is up and running now. We in health are not separate from this. We've got about 150 staff who are working in New South Wales but live in Victoria. So they can only access that permit if they're working on the front line and can't work from home. We'll sort it out, but I just want to be really clear. For people who still need to have time-critical medical care, they can always go across the border. And our people who live in some of the regions can still access healthcare in Victoria, but they will need to self-isolate, and their families will need to self-isolate on returning to New South Wales. So we'll work through the order, we're working through with communities in understanding what the changes have been. And for all the other people in the community, I thank you again for coming forward and being tested. As we've discussed previously, please be tested at only the remotest respiratory symptom. Come forward and we'll test you. For people who've been travelling in Victoria or been to one of those hotspot zones in Sydney, you don't need to have symptoms to come forward for testing, and we'll test you anyway. So again, my huge thanks to the community. Those of you who have got businesses for undertaking your business safety plans, for everybody living in our communities during this time of uncertainty, thank you very much for adhering to your hand hygiene and your social distancing and keeping away from those large gatherings. Today we've got a couple of people to speak with you. I've got Dr. Len Bruce who's going to talk to you about things medical, and then across to New South Wales Police to talk about the border order and the restrictions that are coming in place at the end of the week. So I'll hand over to Dr. Len Bruce. Len, thank you.